So when I speak to patients about diet, I speak about two things. First, the acute situation when you first meet the doctor and you're perhaps receiving chemotherapy or surgery or radiation. There, I would say we don't have a huge amount of evidence that diet makes a whole lot of difference. And indeed, many of the therapies that we give can alter your sense of taste and smell, and therefore makes it difficult to stick to any particular rigid diet. In that setting, as it's turned out, our major concern has been that the process of therapy itself tends to fatten you rather than thin you. You know, you all remember Love Story with Ally McGraw, Thin and Wasting Away? Or am I the only one who dates to that era? In general, people tend to gain weight when they go through early therapy for breast cancer. They're not burning off as many calories, and their friends bring them greasy casseroles, calories in, calories out. The longer term issue, though, is how about the rest of your life? And there, I would say, actually, a member of our panel, Rowan Schlabowski, ran a wonderful trial a few years ago where patients, following their initial therapy, were randomized either to see or not see a nutritionist. And the nutritionist's role in life was to teach the woman to have a low dietary fat intake. And as far as I know, this is the only really good randomized trial in this area. And it certainly suggests that dietary fat reduction significantly improves your outcome if you're a breast cancer patient, and interestingly, particularly if you're a patient whose tumor lacks estrogen receptor.
Yeah, I guess I could extend that. Thanks a lot for that plug. But there was 24% fewer breast cancer recurrences, and a recurrence is oftentimes represents a non-curable condition. For women on the randomized to the lifestyle program targeting dietary fat intake reduction, but I really hasten to add that the weight loss wasn't a target. There was a 6-pound weight loss associated with it. I think our current understanding, as Dr. Hankinson previously mentioned, is that probably now body weight and physical activity would be felt to be bigger components. And so I think the recommendation and I'm updating that trial at the present time with 13 years follow-up. So we'll see if a survival benefit. There was no survival benefit at the time we reported that a few years ago. But so I think the recommendation would be trying to maintain or get to some weight loss and increase your physical activity. And the physical activity targets for breast cancer recurrence risk seem to be quite modest. It's walking like 3 to 4 hours a week. And it's different than cardiology, where you have to be sweating and get your heart rate up, and it's very messy. Here it's walking, and this is my favorite thing, is that of course we're doing analyses on this now in the Women's Health Initiative, and other people have published these kind of findings that dog owners are much more likely to meet target physical activity endpoints. And so in terms of some of the therapies we have now that are running $100,000 a year, a proposal would be to present every woman who's diagnosed with breast cancer with a Labrador Retriever puppy. Acquisition costs $500. Maintenance costs $1 a day for food. By the time she's done with the chemotherapy, the dog would be available for walking. And Mitch Dowsett, another member of our panel here, pointed out the flaw of this argument as I presented at St. Gallen meeting last year in Switzerland. He said, Rowan, he says, you'll need to stratify. He said, because I walk the dog in my house.
And of course, Sun Valley is the dog capital of America, I'm sure. All right, so, go ahead. Sorry, Kathy, please.
There are a couple other comments that I would just make that are well known to our panelists and perhaps to many of you. But alcohol is one thing that should be discussed in the context of diet and what should the breast cancer patient take or avoid. Many of you may have read of a very large study that was reported that was done at Kaiser. And they're very good at keeping records. And so every woman who was diagnosed with breast cancer kept a diary of her alcohol intake for the succeeding 5 years. And they knew, of course, what was the outcome of those women at 5 years. And they were able to go back and look at, was there a relationship between reported alcohol intake and recurrence? And what they found was that there really seemed to be a cutoff of about 4 drinks or more a week increase the risk of recurrence. So I think it is something, certainly one of the factors in the Bay Area for the high incidence of breast cancer is high alcohol intake. We live very close to the Napa Valley, and it's a good and a bad thing. So that's one comment. The second comment I'd like to make is that I think it's very important to make a distinction between a nutritionist and a dietitian. A dietitian is trained in diet and is a licensed individual. Anyone can call himself or herself a nutritionist. And so many of the people who advertise as knowing a lot about nutrition and saying I'm a nutritionist, they may not have any training or validation at all. They may have a strong opinion, and that may be what then the seeking patient will get. So do keep that in mind when you ask for advice.
While we're on that, my favorite pet peeve these days is the wildly common form of quackery, which is suddenly epidemic, which is if you don't eat sugar, your breast cancer won't come back. How many of you have heard this one about sugar? Yeah, you have. It's utter rubbish. Utter rubbish.